Hello, my name is Gabriel Germán Garcia. I'm a pharmacist. I am pharmaceutical technical director. I am also a scientific director of Gabarito, that is a company specialized to help to another pharmaceutical companies in their investigation process. Today I'm going to talk about the blood disorders and thrombi and the analysis we made to a product of Herbetom that was thought for this illness. Topic to address today. Well, we are going to talk about the effect of the combination of polyphenols and active principles. We are going to review the pathology, product composition, studies made, indications, dispensing tips, a resume of what I have talked, and a patient profile that will help us to see to which kind of patient this product is thought. Well, this product contains a combination between polyphenols and active principles. The polyphenols are antioxidants, so they have also another actions as anti-inflammatory, antimicrobial, antihistamine. But this product also contains active principles. These active principles act on certain pathologies. So the combination of polyphenols and active principles has a synergic effect. What this means? This means that the combination of polyphenols and active principles will have a stronger effect than if we use them separately. Separately, of course, these products will have an effect, but the combination it has a very, very powerful effect. Also, what we look to avoid chain reactions. Typical triggering reaction is the asthma. That the asthma is an illness that develops in a smooth way, but suddenly the patient will produce a product called adrenaline, and it will start an asthma attack. So an illness that was developing in a smooth way suddenly starts increasing the symptoms a lot. So what we look is to avoid that fast increase of the illness. We look that to have a smooth evolution and after a smooth decrease of that illness. Okay. We also look for the microbial enhancement. Why is so important the microbiota enhancement? Well, we know that there is a strong relationship between the immune system and the microbiota enhancement. A equilibrated, a balanced microbiota, okay, makes that the immune system works in a better way. The healthier or the more balanced is the microbiota, the better the immune system will work. It also have a multifactorial effect, this combination. There are different ways of treating a pathology. These factors, okay, this makes that critical changes in the cells, and this critical change in the cells will improve the symptoms of the disease. Usually, the normal medicine, the allopathy medicine, use one way to treat the disease. But the good thing of the natural medicine is that the natural medicines use different ways to treat the illness. So it looks for the synergy. The combination also is very good for the reduction of free radicals and also contribute to homeostasis. I'm going to explain this more now. Well, what is a free radical? A free radical is a molecule that has lost an electron. So this free radical is quite unstable, so it tends to steal one electron to the DNA or the cellular membrane. And when it steals this electron, this DNA or cellular membrane will not work. So the organism has a reaction through an enzyme called superoxide dismutase that converts the free radical in a normal atom. So the free radical has no necessity to steal these electrons to other molecules. But what happens in a situation where there are a lot of free radicals produced? For example, smokers, pollution, diseases, inflammations, chronic inflammations, etc., etc., etc. Well, then there are a lot of free radicals produced, and there are not enough superox dismutase to neutralize them. So these free radicals that are not neutralized by the superox dismutase steal electrons to the DNA and the cellular membrane, inactivating them and making that the DNA and cellular membranes in that system, making that the system where these free radicals are will work worse than usual. Okay. So fortunately, there are antioxidants. Antioxidants are vitamins or polyphenols that have the capacity of giving very fast, in a very fast way, electrons to these free radicals, inactivating them. They give it so fast and so easy that the free radicals has no necessity of stealing the electrons to the DNA or the cellular membrane. And also, once the antioxidants have given these electrons, they do not converge in free radicals. So the free radicals are neutralized. This combination also contributes to homeostasis. What is homeostasis? Homeostasis is the capacity of the body to have to recover from a small damage. For example, a small ache, okay, you have or a small swelling or a small inflammation. If you have a small problem of any kind, the same organism, due to the homeostasis system, will recover your health level. The better you have the microbiome, the best way the homeostasis system will work. Okay, so if you have your microbiome is not well balanced, then small problems will become illness. But if you have a good microbiota, then big problems will not develop in illness because you have a strong homeostasis system. We know that polyphenol, physical exercise, and a proper diet, and getting the right hours of sleep will contribute to enhance the microbiome and improve homeostasis. I have made this graphic in order to explain better what I have said. In this axis is the health level, and this axis is the time pass. You have Peter. He is a healthy person. Okay, he may have some small problem, but his homeostasis system is always regulates his problems, and he's always in the healthy area. It may happen also that someday he may have a small symptom, but his homeostatic system may recover him, and he will reach the healthy area again, the healthy level again. Okay, he may be in this level for many years, no? But suddenly he may start getting worse. He will develop some symptom, but his homeostatic system, for any reason, cannot bring him to his healthy level, and he will start getting worse, and he will develop an acute illness. Okay, if we give him a product, he will recover, and he will recover his initial level. But if he is not treated, he will continue worsening and worsening and worsening until he will develop a chronic illness. Well, we have John, it's another person. He may be younger than Peter, but his health level is worse than Peter. He has always symptoms. There are days that he has more symptoms than another, but he's always in the symptom area. Sometimes even he may develop acute illness, okay, but his homeostasis system may bring him again to his usual level that is in the symptom area, and he may be in this area during years. But suddenly, someday, he may develop an acute illness, and if he is not treated, he will develop a chronic illness. And if he is not treated in this area, the chronic illness will develop, and he will start getting worse and worse slowly. Okay, but what happens if we treat a person in this area? Okay, we will bring her to his initial level, or even we may bring her to a better level. But we must be aware that to reach this point, it has passed months or years. So we cannot reach this level in days, okay? So we will need weeks or months until we will reach this level, okay? Since to recover from a chronic disease takes more time than when you are in an acute illness. Well, now I'm going to talk about the blood circulation. There are two kinds of vessels. There are the arteries, okay, that they carry blood from the heart to the organs, and their walls are wider and more elastic than the veins, and then veins that they carry blood from the organs to the heart, and their walls are thinner and they have walls. Okay, they have the arteries are wider because the medium layer of the arteries contains smooth muscle. The veins also contains smooth muscle, but this smooth muscle is not as big as the one that contains the arteries. The veins also has valvules. These valvules are in order to avoid that the blood will go down between every contraction of the heart. Okay, every time that the heart contracts, the blood goes up. Okay, and when the heart expands, then the blood will lower. Okay, but fortunately we have valvules that avoid that the blood goes down. Okay. Well, as I told you, there are three layers in the vessels: the external layer, the median layer, and the internal layer. The internal layer is very important because it allows the exchange of nutrients and waste. Since there are a lot of exchange, these cells consume large amount of energy due to active metabolism, due to the many things they do. Okay, they also regulate coagulation, and they also regulate the nitric oxide. This molecule is very important because the nitric oxide, when the person segregate or the animal segregate nitric oxide, the arteries or the veins increase its size. Okay, increase the diameter of the veins or the arteries. Okay, and what happens when there is a pathogen? Well, if there is a pathogen in the internal layer, then it will be, of course, a damage. Then the regulation of the coagulation the regulation of the coagulation will work wrong, will not work in a normal way, and it will appear thrombus. And if a thrombus appear, there are a lot of chances to appear an accident vascular, generally in lower limbs. I am also going to talk now about the atemoratus plaque. Okay, atemoratus plaque is a plaque that appears because the cholesterol builds up in the inner wall of a vein or artery. Okay, when the cholesterol builds up in the inner wall, a series of oxidative reactions happens and appears the atherom plaque formation. So it's a plaque that is in the inner part of the veins or arteries. So since there is this plaque, the diameter of the artery decreases. Okay, so it may happen two things. One, that a thrombus that has been formed in another part of the body cannot pass through this area because of the decreased the diameter of the artery has been decreased. So it will appear a stroke. Okay, we must be aware that there is normal that a person has thrombosis in his circulatory system, but fortunately the homeostasis system dissolves these thrombosis soon. But the problem is that when this thrombus gets in contact with an ateromatous plaque, because the size of the artery is decreased. Also, it may happen that the plaque may be released in the blood. There is no thrombus, but some part of the plaque, since it are quite unstable, some part of the plaques separates from the plaques, and this plaque also may obstruct the vessel in another part of the circulatory system, and also will appear the stroke. So we have this product Barrymore in order to try to avoid this problem. Okay, the composition is made of standardized and nebulized extracts of different medicinal plants plus vitamins. It's very important to know that these products are standardized, because we know, for example, that horse chestnut contains a 20% of steam. Why is it so important to know this? Because we have selected one active principle in each plant in order to know which is the content of the active principles of this plant. Because imagine that there is a year that the harvest was bad, and the horse chestnut, instead of having a 20% of steam, contains a 10% of steam. You may add 150 milligrams of horse chestnut, but it will be not as effective as it will contain 20% of steam. So all the plants that are used in this product are standardized, and we know that they have at least a minimum percentage of each active principle in order to be sure that the product will be work correctly. One of the proofs we made, or analysis we made in the Universidad de Murcia, was a gas chromatography. This gas chromatography measures the volatile active principles. It measures parts per million of product. So it measures quantities of this amount, 0.000001 milligrams. Okay, so it measures traces of product. So these are the peaks. These peaks are the different active principles, volatile active principles we found in this product. And if you measure the peak, you will know the amount of this active principle that is in the product. What we found was that this product did not contain toxic ingredients at significant concentrations. Think that we are measuring parts per million of any product that are in this product. Well, these are the active volatile ingredients we found. We saw that 47% of them are antispasmodic. So what this means, imagine there is a vessel and it appears a thrombus, okay? And if the vessel cannot increase its size, the thrombus will stop there and it will appear the stroke. But since this product have antispasmodic effect, it will be easier that the vessel will increase its size and the blood and the clot will pass through this vein, and after the homeostatic system will dissolve the thrombus. Okay, we found a product with antibacterial and antispasmodic activity, several with antispasmodic activity, several with anti-inflammatory activity. Think that a vessel that has damage, this vessel will be also inflamed. Okay, so this product also has anti-inflammatory capacity, it also has antimicrobial capacity, and it is also antioxidant capacity. Well, another study we made, another analysis we made was the polyphenol content. It was 997 milligrams of gallic acid for 100 grams of product. This is a way of measuring the phenol content. As we measure the distances in miles or kilometers, we measure total phenol content in this way. Since this is a very abstract way of showing the polyphenol content, I have put this graphic where I have compared the Barrymore against different fruits. Something important is why we made this measure, because there is huge relationship between the polyphenol content and its antioxidant capacity, and also we know that the polyphenols are very interesting, very important for balancing the microbiome. So the bigger content of polyphenols a person intakes, the more chances this person has to have a balanced microbiota. Well, we also measure the antioxidant capacity. We measure in ORAC units. Okay, we saw that it contains 892 ORAC units per capsule, or 142,300 ORAC units per 100 grams. So this is a huge capacity. So I have made this graphic in order to show you the ORAC activity against several fruits, but there is also another way of measuring it, or it's another way of seeing the huge antioxidant capacity this product has. The FDA suggests 5,000 ORAC units per day to reduce the effects that the free radicals causes in our body. Just think that 2 capsules contain 1,800 ORAC units, okay? So you are taking about more than a 40% of the ORAC units a person must take daily, just with 2 capsules, okay? So the antioxidant capacity of this product is very, very good. It's huge, as I told you. And why is so important, the antioxidant capacity? The antioxidant capacity is very important because it intervenes reducing the oxidative stress, and since there is less free radicals in the blood vessels, the vessels will work better, okay? So I repeat again, the antioxidant capacity lowers the concentration of free radicals in the blood, and then since there are less free radicals in the blood, the circulation system will work better. Another study we made was the anti-inflammatory capacity. We saw that the percentage of inhibition of the 15-lipoxygenase was 36.1%. What does this mean? Well, the 15-lipoxygenase is a pro-inflammatory agent. So the more inhibited is this enzyme, the less inflammation will have the veins, okay? So it has also a very interesting percentage of inhibition of this enzyme. So we can say that this product has an anti-inflammatory effect over the vessels. Or, sorry, it has an anti-inflammatory effect in the vessels. Well, I am also talking about, this product has very interesting active ingredients, but I am going to talk about 2 for avoiding to make a long explanation. It contains astaxanthin. This product is a powerful antioxidant, so it will fight against the free radicals that are in the blood that avoids the blood system works in a correct way. And also, this molecule is produced by the alga Amotocus pluvialis as protection against oxidative agents, but also improves the cholesterol metabolism. So it lowers the cholesterol inside blood. Why is important this? Because remember that the atheroma plaques are formed with cholesterol. So if we have low levels of cholesterol, we have less chances of forming big atheroma plaques. But it also lowers the blood pressure. Why? It's important this, because we know that the higher is the blood pressure, the more chances you have, the patient have to have a circulatory accident, to get an artery broken or a vein broken. Okay, why? Because the bigger is the pressure, the veins suffer more, or the arteries suffer more than where the lower the pressure is in a normal way. Okay, so this product also lowers the blood pressure, so it's more difficult that the veins, of course, the veins or arteries that are insane, that are not in a healthy way, will break. Sorry. It also contains nattokinase. Nattokinase is an enzyme produced by a bacteria called Bacillus subtilis. It dissolves the clots and is antithrombotic. So it's good because if there is a clot in the blood, it will dissolve it. It will have to dissolve it. Apart the homeostatic system, this enzyme will have to dissolve the clot, and it's also antithrombotic. It means that it will avoid the clot's formation. So it works in two ways. It dissolves the clot and also avoid the formation of the clot, but also lowers the blood pressure. Remember what I have told one moment ago. The lower is our blood pressure, the less chances we have to have a stroke. Of course, we cannot have the pressure very low, the blood pressure very low, because then the people may get dizzy, and all that side effects that you have when the blood pressure is low. And also so that's why it prevents cerebrovascular accidents, because lowers blood pressure and dissolves clots. Well, which effects has this product? We know bibliography that it is lipid lowering, antiplatelet, and also prevents thrombus formation, and also has a venotonic action. It makes that the vessels will work better. It is test and measure its anti-inflammatory action and its antioxidant action. Well, which are the indications of this product? Well, first of all, mitigation of the atherosclerosis progression. Think that this product will lower the cholesterol in blood and also has a huge antioxidant effect. And remember that the atheroma plaques are formed because a combination of cholesterol and oxidant reactions. So if we have less cholesterol in blood and we have antioxidant product, the chances of having big atheroma plaques decrease a lot. It is also antithrombotic. So there are less chances of having a clot or a thrombus in blood. So it prevents ischemic stroke. Okay, it is a powerful antioxidant. It also is very good for varicose veins. Okay, but this kind of, not the normal varicose veins. I mean this kind of varicose veins, big varicose veins. Okay, for old people who has very bad blood circulation. It also is very helpful in phlebitis because it decreases the free radicals that are in the area, okay, because of the inflammation because of the inflammation due to the phlebitis, and it also will restore the capillaries and the other and the vein that was damaged due to that thrombus that provoked the phlebitis. And also it's an anti-inflammatory because without very good capacity, because it decreased the lipoxygenase in a 36%. Well, dispensing tips. What to tell to a person that we think that person must take this product? Well, it prevents venous thrombi. There is no risk of bleeding, bruising, or petechia. Petechia are those small spots that appear when someone is taking antithrombotic products. It's also an analgesic of painful and thick varicose veins. Think in old people who has those varicose veins I already showed you. Okay, this is a very good analgesic because it will restore. It will make that the blood circulation will work better. It will also decrease the size of those varicose veins, so the people will feel better and have less pain. Also, it's very interesting in long duration trips. Okay, think in the plane trips. Okay, that we call that this is very useful for the syndrome of tourist class, because when someone is in a plane, there are two problems. He has a very small space, so he cannot move his legs. And if you don't move the legs for a long time, the chances of getting a clot are very big. And also the planes, the air of the planes are very dry. So you are dehydrating in a very smooth way, but you are dehydrating. So your blood is thicker than usual, and also you are not moving. So if you don't move your legs, okay, the chances of making a thrombus is very high. That thrombus is usually made in the legs. So it's released to the circulation, and it usually goes to the heart or to the lungs, and people has a stroke. Okay, it's also very helpful in diabetic and hypertensive patients, because these patients, the glucose is damage the veins and the arteries. So this product will help this kind of patients to avoid problems with the blood circulation. Okay, and we know that it's safe, effective, based on studies, has an extensive use. Well, summary. What I hope that you remember of this speech. First of all, the polyphenols and volatile principles have antioxidant, anti-inflammatory, antispasmodic activity. We have measured the antioxidant, anti-inflammatory activity, but also it's very important that are antispasmodic, because think in this situation, there is an atheroma plate and a thromb. Okay, if the vein cannot increase its size, okay, it will happen this. The thromb will stop in the vein and it will appear the stroke. But if the vein or artery may increase its size, okay, then the thromb will stop just 1 second or less. The vein or artery will increase its size, and the thromb will pass. And after, this thromb by the homeostatic system will be dissolved. So we can avoid a stroke if we increase the antispasmodic activity of the vessels. Also, we know that about the atheroma plate has effects, since it decreases the progression, you know, and also it's lipid lowering, so also it will be less cholesterol in the vessels, so it will be less chances of having big atheroma plates, so it has a vascular protection activity. But it also decreases the blood pressure. Remember that the higher is the blood pressure, the biggest chances we have that a damaged vessel will break. And also thrombosis has an activity because it dissolves them and it avoids also the formation of them. So the chances of have a cerebrovascular accidents decrease a lot, okay, because there are less thrombosis, the blood pressure is lower, it lowers the blood pressure, and there are less chances of have an atheroma plate, or has less chances of have a big atheroma plate, because unfortunately with the age there are atheroma plates all over the body, okay, but the idea is to have small atheroma plates. Well, patient profile. I have selected 4 kinds of people in order to have a more clear vision to what kind of people is this product think. Well, there's Herbetom. He's around 66, he's a smoker, he's sedentary, he's overweight, and he has a prominent belly. Okay, think in those men who has a very big belly, you know, it's like they are formed by 2 parts, a normal person and a belly, okay? So, so this man has very big chances of having a stroke. So you must tell him to change his habits, just to walk 30 minutes per day, nothing more, and just to try to lose some weight, 10 kilograms, 15 kilograms. In people that has so much overweight, it's very easy that they will lose weight, okay? Just taking out the chips or the bread, you know, just with some small changes in his normal diet, they will lose weight. Don't try to tell them not eat nothing. Don't try to put them a very difficult diet, because they will not do it. But if you just tell them, don't eat chips, don't eat, if you drink 5 beers per day, just drink 2, just small things, they will lose weight, they will feel better, you know, and they will do the treatment. And he must take 1 capsule every 12 hours in order to lower the blood pressure and in order to avoid the formation of thrombosis. We also have Sophia, around her 60s. He has large varicose veins. She has swollen legs and feet, and a hot and cold sensation in legs. that is very normal in persons who have bad problems with circulation. This is because the blood regulates the sensation of cold and hot. So this person with that has circulation problems may have in one moment in one part of the leg hot, 30 minutes later in the same part of the leg cold. That is because they have a very bad circulation in that area. It also may happen that the legs hurt while walking. Okay, so she has to stop walking every 5 minutes, 10 minutes, 15 minutes. That is because the blood with oxygen does not reach the muscles in normal concentrations. So since the oxygen does not arrive the muscles in good concentrations, the muscles start aging because of the lack of oxygenated blood. So what does this product? This product improves the circulation. So since the vessels work better, it will reach more oxygenated blood will reach the muscles, so the person will not have this problem. She must take 1 capsule every 12 hours. Now we have Alejandro, 35 years old. Whoa, this guy should have no problems, right? Yes, but he loves to travel to exotic countries. So he spends a lot of time in planes. He may be also an sportman, okay? So, but he may have a lot of chances of having the syndrome of tourist class, okay? Because he's in an urban space during many hours and in a dry atmosphere. So what he must do? Well, in order to avoid any problems, he must take 2 capsules of this product 24 hours before the trip and 2 hours before embarking. So he must go to airport with 2 capsules, take the capsules, and he will be safe for the trip. Also, I have put Agustin, he's around his 40s, okay? He has high blood cholesterol level. That is a factor that can accelerate the formation of atheroma plates. And we know that he has problems with the blood circulation because he has large varicose veins. Maybe behind the knee, but usually they have behind the knee, and he may have varicose vein in other parts of the body. In spite he does moderate sport, he has big chances of have a stroke, okay? So he also must take 1 capsule every 12 hours in order to avoid problems. Well, thank you very much for your attention. I hope you enjoyed this webinar. And if you have any kind of question, please don't hesitate to write me to this email address. My email address is gg@gaber.pt. Thanks for your attention. And if you have any doubt, please don't hesitate to contact me. Thanks a lot. Thanks. Bye-bye.